Hello, and welcome to another edition of Black Health Matters, where we discuss issues that matter most to us and work together toward a healthier future for the African American community. I'm your host, Daly-Mack, RN, and today we're focusing on two topics. National Public Health Week started this Monday and ends on Sunday. That observance overlaps with Black Maternal Health Week, which starts April 11th and ends on April 17th. We will put a spotlight on public health, what it means, how it works, and most importantly, its impact on the health inequities we face, including the serious issue of Black maternal health. Public health is about protecting and improving the health of entire populations. It's not just about treating illness, but preventing it through education, policies, and community programs. It sounds like a big picture idea, and it is, but it trickles down into every aspect of our lives. For African American communities, public health has played a crucial role in addressing disparities, although there is still so much work to be done. For example, did you know that African Americans often experience higher rates of chronic conditions like diabetes, hypertension, and heart disease? Of course you know. I've told you before. But these disparities are deeply rooted in systemic barriers like limited access to health care, food deserts, and socioeconomic inequality. Public health initiatives aim to tackle these issues by creating programs that provide free health screenings, promote nutritious eating habits, and advocate for policy changes. Another key area is mental health. Our community faces higher levels of stress and trauma, often rooted in systemic racism and economic hardship. Public health campaigns have begun addressing this by destigmatizing mental health care and increasing access to counseling services. And let's not forget about the role of public health during emergencies. Whether it's the COVID-19 pandemic, natural disasters, or environmental health threats like lead poisoning and water supplies. These crises often hit African American communities hardest, but public health efforts have provided resources like free testing, vaccination clinics, and disaster response teams to mitigate the impact. Now let's take a closer look at maternal health, a critical issue that disproportionately affects African American mothers. The statistics are staggering. Black women are 3 times more likely to die from pregnancy-related complications than white women in the United States. This disparity is not just about access to care, but also about the quality of care received and the systemic biases embedded in our healthcare system. So why is this happening? Factors like underlying health conditions, lack of access to adequate prenatal care, and implicit bias within healthcare settings all play a role. For example, studies have shown that healthcare providers may underestimate the pain levels of Black patients or dismiss their concerns, leading to delayed or insufficient treatment during pregnancy and childbirth. Public health initiatives are stepping up to address these inequities. Programs like community-based maternal health services offer culturally tailored support to expectant mothers. These services often include access to doulas, who are trained professionals who provide emotional and physical support through pregnancy, childbirth, and postpartum. Research shows that the presence of a doula can improve birth outcomes and reduce complications. Another vital area is education and advocacy. Public health campaigns work to raise awareness about the disparities in maternal health and push for policy changes to ensure better care for Black mothers. For example, initiatives like the Black Mamas Matter Alliance advocate for reproductive justice and the expansion of Medicaid coverage to include postpartum care for up to a year after childbirth. We also need more training for healthcare providers to recognize and address implicit bias. Programs like bias training and diversity education can help professionals provide equitable care to all patients, regardless of race. In addition, technology plays a growing role in improving maternal health. Telehealth services offer expectant mothers access to virtual consultations, connecting them with specialists who may not be available locally. Apps designed for pregnancy tracking and health monitoring are empowering women to take care of their health and detect potential issues early. While progress is being made, there's still a long way to go. Addressing maternal health disparities requires a multifaceted approach, one that includes community support, systemic reforms, and grassroots advocacy. It's about creating a healthcare system where every mother, regardless of race, receives the care, respect, and attention she deserves. As an African American nurse, this issue is close to my heart. It's a call to action for all of us to support Black mothers, amplify their voices, and demand the changes that are desperately needed. But while public health is essential, it can't solve everything. We need to advocate for fair policies, invest in our communities, and push for systemic change in healthcare institutions. It's about creating partnerships between health professionals, policymakers, and individuals like you and me, so we can build a healthier and more equitable future together. So what can you do? Learn about public health initiatives in your area. Support organizations and campaigns dedicated to reducing health inequities. And don't forget the power of your voice. Whether it's sharing information, volunteering, or advocating for change, your efforts matter. Well, that's all for today's edition. Thank you for tuning in to Black Health Matters. I'm Dawn Daly-Mack, RN, reminding you that our health is our wealth. Let's work together to protect it. Until next time, stay informed, stay engaged, and always remember that Black health matters.